Do you know the early signs of cancer? That's a question we all should be able to answer. Cancer, a rampant global health issue, continues to claim lives despite leaps in medical intervention. One of the key challenges lies in late diagnosis, often leading to compromised treatment outcomes. The power to change this narrative rests in our hands. By understanding and recognizing the early signs of cancer, we can enable timely intervention and significantly improve prognosis. With that understanding, let's dive into some of these early warning signs. Unexplained weight loss can be a sign of various cancers. It's not uncommon to shed a few pounds here and there, especially if you've made changes to your diet or exercise routine. However, if you find yourself losing weight rapidly without any apparent reason, it could be a red flag. This is particularly concerning if the weight loss is accompanied by other symptoms such as fatigue or changes in bowel habits. Speaking of fatigue, let's delve into that. Persistent fatigue, the kind that doesn't seem to improve with rest, can also be a warning sign of cancer. This isn't the typical tiredness that comes after a long day at work or an intense workout. We're talking about a constant state of exhaustion that doesn't let up, which can be a sign of an underlying health issue, including cancer. Then we have night sweats. Waking up in a pool of sweat on a regular basis is not a normal occurrence. Unexplained night sweats can be indicative of several health conditions, including certain types of cancer. If your night sweats are frequent and are not linked to a known health condition or menopause, it's worth getting checked out. Sleep disturbances, such as insomnia that persist over time, should not be ignored either. While there can be many reasons for disrupted sleep, persistent sleep problems can sometimes be a sign of cancer. Next, we have mood changes. Persistent feelings of sadness, depression, or apathy can be associated with some types of cancer. If you've noticed a drastic or sustained shift in your mood, it's important to discuss this with your doctor. Cognitive changes such as confusion, memory loss, or other cognitive impairments can also be early signs of cancer. If you or someone else notices that you're having trouble remembering things, making decisions, or thinking clearly, don't brush it off. Moving on to physical symptoms, enlarged lymph nodes, especially those that are painless, can be a sign of cancer. If you notice a lump or swelling in your neck, underarm, or groin area, it's time to see your doctor. Unexplained fever that doesn't go away can also be a sign of underlying malignancy. And seizures, especially those that start in adulthood, can be indicative of brain tumors. Lastly, for this segment, a visible mass or lump that doesn't go away should be evaluated promptly. This could be an early sign of various types of cancers. These are just some of the signs, but there are more to be aware of. Skin changes can indicate a potential problem. Moles that grow or change in appearance, skin lesions, or discoloration should be closely monitored. These alterations could point to skin cancer, the most common of all cancers. Bleeding that can't be explained should also ring alarm bells. This includes blood in stool or urine, or unexpected vaginal bleeding. Such symptoms require immediate medical attention as they could be signs of various cancers, such as colon, bladder, or cervical cancer. Persistent abdominal pain, changes in bowel habits, or vomiting are all gastrointestinal symptoms that should not be overlooked. They could signal digestive system cancers, including stomach, colon, or pancreatic cancer. In addition, urinary changes like difficulty urinating, changes in urine color or odor, or blood in the urine can be indicative of bladder or kidney cancers. Turning to the reproductive system, women should be aware of pelvic symptoms like abnormal vaginal discharge, pain during intercourse, or pelvic pain. These symptoms could point to reproductive system cancers, such as ovarian or cervical cancer. Breast changes are another crucial warning sign. Any changes in breast size, shape, or texture should be evaluated, including new lumps or nipple discharge. These symptoms could be early signs of breast cancer, the most common cancer among women. Respiratory symptoms like a persistent cough, hoarseness, or shortness of breath can be signs of lung cancer or other respiratory cancers. Lung cancer is the leading cause of cancer deaths for both men and women, so these symptoms should not be ignored. Finally, unexplained pain that persists without a clear cause or that doesn't improve with treatment should be investigated. This could be a sign of various cancers, depending on its location and intensity. Remember, these symptoms can be signs of other health conditions as well, not just cancer. It's crucial to consult a healthcare professional if you experience any of these symptoms persistently. Early detection is key to successful treatment, so don't hesitate to seek help if you notice any of these warning signs. Early detection plays a crucial role in cancer treatment. It's like having a secret weapon that gives you an edge in this battle. Therefore, regular health checkups and screenings should be a part of your health regimen. They can be your radar, detecting any abnormality before it becomes a full-blown issue. If you find yourself experiencing any persistent symptoms, don't hesitate. Consult with a healthcare professional for a comprehensive evaluation and appropriate guidance. Remember, timely action can save lives.